Hello.
Good morning.
All right, let me see if I can get Meredith. Oh, there she is. Okay. I don't see her yet. Make sure you have your books. Because we will kind of flip through some certain pages. So Meredith, I just told them, make sure you guys have your books out too. Let me see. Make sure everything's on. All right. If we go through, something we haven't been doing is when we go through, if I ask you a question and you don't want to answer verbally, can you see up here where it says, wait a minute, where is that? Well, now I don't see it. I was thinking there was a spot where you guys could actually talk to me, but we won't worry about it. Don't worry about it. All right, so everybody has their book out? We're ready to get going?
Yep.
Make sure, all right, let me make sure everybody's talking. Go ahead and say something, Rebecca.
Yes.
Okay, Meredith?
Hey.
Okay, I just want to make sure everybody can hear everything. All right, guys, so today we're going to probably have to split this up in two, but we're going to kind of briefly go through what we've learned for this whole semester, okay? And I'm going to break it down so it's not so overwhelming, I hope, okay? Anytime you have questions, please say something, okay? So I don't know if you want to take notes, but you guys have this PowerPoint that I put on week 15, right? Okay. All right, let's start. What's that?
Do you want us to bring it up on our computers?
I don't know. Can you see the one I have on?
Yeah, but it's small.
It's small. Well, if you want to bring your own up, that's fine. Yeah. However it works for you. I'm going to be munching on an apple. I apologize, but I'm starving. Very nice job, guys, on both the discussions and the videos. I really wanted Miss Frum to see them, and she loved them. She was so impressed with you guys, so it made me feel proud.
Yeah.
I didn't know if, like, when we asked the interviewer questions, if they were supposed to answer. So I was like, great, just answer them.
It was fine either way. It was fine either way. It was kind of neat to see how different they were. So that was cool. I like that.
My husband said, I am not answering these.
I figured. I said, bless his little heart. And Meredith, your dad was very impressive.
Thank you.
Everybody's were. Because that's not easy, is it?
Miss Frum said he should get the Academy Award for it.
He should. He should get the Academy Award. Yep. He's done a few of those, I think.
Well, considering he had been one for prosecuting attorney, he works at 6 law firms. Yeah.
Yeah, I think he's done that a few times. All right, girls, are we ready? Everything's up?
Yes.
All right, let's start. All right, so I kind of broke this down into what we need to know, okay, from these. So if you remember from chapters 1 through 3, the biggest thing we were concentrating in the beginning was what rights you guys have, right? So there was the right task, circumstance, person, direction, and supervision, okay? So I kind of broke it down even further. So you guys definitely need to know those 5 rights, okay? But the right task, remember, does my state facility permit me to perform this task? So that's what it's asking. Am I allowed to do this task? Is it in my job description? Okay. Do I have the qualifications to perform it? And many of you guys even use that in your video. So I was glad to see that. You were like, so, you know, you kind of ask those questions about job descriptions and that kind of thing. So that was nice. All right, right circumstance. Can I perform the task safely for this patient? Okay. Do I have the equipment I need to perform the task? And is the patient stable enough for me to perform the task, right? So if the person's having a really bad day breathing wise, are you going to do a bunch of oral care and force this and that? No. You have to always look at the patient, okay? Just because it's written on your your treatment plan for the day, doesn't mean that you're always going to be able to do those things. All right person. Do I have the confidence, training, and experience to perform the task? Is the nurse or is your supervisor asking you to do something that we did not cover or you've never been trained to do? You don't have to say yes, remember. If you don't feel comfortable, you need to ask for help or training. Okay, that's what this one means. Do I have any reason to hesitate? Okay, do I have concerns about the procedure? Right direction. Did the nurse give me enough information so I know exactly what I have to do? Okay. Did she just give you a job and say, go do it, and you don't feel comfortable about the situation? Then you need to ask for more direction. Do I, excuse me, do I understand what the nurse expects of me? And then the right supervision. Will the nurse be available to answer any questions that arise and make sure the last word, I am, what does that say right there?
Perform.
Thank you. You guys are covering up that. I wonder if I can lift you up a little bit. There we go. All right, the task adequately and safely. Okay, so that's the 5 rights of delegation. Make sure you know a little bit about each one. Okay, I know that we ask a lot about the right task. Okay. And for some reason, can't see some of these. I wonder if I can hide this thing.
I moved you up to the top so I can see it all.
You can
Yeah,
move.
I'm having trouble with this stupid thing up here. I wonder if I can make this smaller.
Hey, Emily, thanks for waking me up.
I was up at like 7:30 looking at Amazon.
I'm just going to say, if it wasn't for Emily, I wouldn't be on here.
Well, you were answering my text pretty early this morning. Okay. Everyone who delivers care must comply with federal, state, and local regulations. Patient care technicians must have a working knowledge of laws, especially regarding their scope of practice. Let's go to page 26 in your book, just so that you know that I want you to know these standards. Nursing assistant standards. So that's box 3.4. Okay. The nursing assistant performs nursing tasks within the range of functions allowed by the State Nurse Practice Act and its rules. Is honest and shows integrity in performing nursing tasks. Bases nurses' tasks on his or her education and training. Also bases them on nurses' direction. So make sure you're jotting down that you need to review this. Okay, I'm going to go through it real quick. Is accountable for his or her behavior and actions while assisting the nurse in helping patients and residents. Performs delegated aspects of the nursing care. Assists the nurse in observing patients and residents. Also assists in identifying their needs. Okay, because you guys are going to be front line. You're going to be more with those patients than the nurses are going to be. Okay. Communicates progress towards completing nursing tasks, problems in completing the tasks, and changes in the person's status. You're going to ask the nurse to clarify what is expected when you're not sure. You're going to use education and training opportunities as available. Practice safety measures to protect the person, others, and yourself. So if you are doing something and you don't feel it's safe for you or the patient, then you need to question that activity, okay? Again, you're going to respect the person's rights, concerns, decisions, and dignity. Function as a member of the health team, and you guys use that a lot in your video. I was proud of that. And respect the person's property and the property of others, and protect confidentiality, okay? And the limits of your role are also on here. Very quickly, you're never to give drugs, okay? Orally, rectally, vaginally, or injection. You're never to insert tubes, okay? It says do not remove them from the body. Some states, and one thing I do want to say, enemas is an example of things you can do, okay? And some states allow you to discontinue these IVs and stuff, so that would be taking things out. So there's exceptions to that rule, okay? We're talking feeding tubes, etc. Never take oral or phone orders from a doctor. Never perform procedures that require sterile technique. Never tell the person or family the person's diagnosis or medical or surgical treatment plans. That is not within your scope of what you can do. Never supervise others, including other nursing assistants. Okay, so remember that. You are not going to be in charge of other nursing assistants. Okay, you might be a team leader, but that doesn't mean you're going to be their supervisor. Does that make sense?
Yeah.
Okay, never ignore or an order or request to do something, but you can respectfully challenge that or ask questions about it. We talked about that. Okay. All right, PCT must be able to handle emergencies. Okay, so you did all of those modules for OSHA. So some of that might be on there, but I just want you to be able to handle emergencies, like if there's a fire in a room, what's the first thing you do, those kind of things. I think we'll get to that. PCTs must honor the patient's rates on page 14. So, we're not going to go through all those, but I want you to know that you need to review very well box 2.2, okay, on page 14. Communication is crucial. You're also going to need to know rules for PCT on page 25. So you are a nursing assistant to the nurse. A nurse assigns and supervises your work. You're going to report observations to that nurse. The nurse decides what is done for the person, okay? Review directions in the care plan with the nurse before giving care to the person. Perform only those nursing tasks that you are trained to do. Ask a nurse to supervise you if you're not comfortable performing a task. And then perform only tasks that your state and your job description and your training allow, okay? I know a lot of this is repetitive, but there's a reason for that, right? All right. OBRA requires a nursing assistant registry in each state. It lists all that. You guys will help me out if I can't see something. All that have completed a nursing assistant training and competency evaluation program. And they keep that information for 5 years, okay? You remember that? So make sure you know that. Certified Patient Care Technician is a certification through the National Healthcare Association. It is going to have about 120 multiple choice questions, and you have 120 minutes to score at least a 390 out of 500, okay? In West Virginia, they call PCTs RNAs. In Ohio, it's STNAs. All right. Remember this. Remember the clock. We had a little confusion, and that was on my part. So remember the clock, because there probably will be questions on the clock. Okay. All right. What's next? All right. Here's the scenario. I wonder. I'm going to have to. I may have to take you guys down a little bit so I can see these slides. All right. So the PCT walks into the room just as a patient falls to the side. The PCT should report the fall immediately to which staff?
The RN.
The RN. So you're going to have the answers on here. I just want you to be aware of these questions, okay? Identifying a patient. You must give the right care to the right person. Always identify the person before starting procedure or task. The person may receive an identification bracelet when admitted to the agency. To identify the person, carefully compare identifying information on the assignment sheet with that on the ID bracelet. Okay, this is important. Use at least 2 identifiers and then follow your agency's policy. Call the person by name when checking the ID bracelet. Just calling the person by name is not enough. Okay, so what would be a better way to identify a patient? Would you walk in and say, Mrs. Smith, your date of birth is this, and you live in this state? Or would it be better to say, can you tell me your name, your date of birth, and et cetera? That
Yes.
one? Right. So be real careful, because I know that there are questions on there that are going to ask you what's the best way. Remember, if you give all that information to that person, they're just going to say yes, right? So if the person's confused or has dementia, they may just respond yes when they aren't the right patient. Okay, and that's very dangerous. So make sure you're asking them to identify themselves, not you giving them the information. Okay.
Something that really bothered me when we went to the hospital was we went over that we're supposed to ask that, and the PCT was going around with us there, and I did what we were supposed to. I said, "Can you verify the name and date of birth?" And she said, "Oh, don't do that. He won't know." And I said, "This is what I'm supposed to do." I said, "What's your name and date of birth?" And he told me right away.
Yeah. And here's the difference, girls, between you guys getting this training and then other trainings out there, right? You're going to learn the right way to do things. So
Yeah.
you need to go, and you're going to find when you get out there, people are going to say, "Oh, don't do it that way." And they'll try to give you shortcuts. Not a good idea. Go with what because it's your back when something goes wrong. Okay. So I always veer towards what I know is right, even if somebody's saying, "Oh, it's so much easier to do it this way." Well, that doesn't look right to me, and that could cause an infection. I see it all the time. So yes, do what you know is right. Now, if that person was confused, what you could do is look at the head of the bed, if their name is there, look at their bracelet and verify it. You can identify it that way. And that's sometimes you're going to have to do that with people who are confused, right? Right.
Yeah.
Yeah. So, but in that situation, you got to try it first. And then if you find that they're really confused, then you've got to find another way to identify them.
It made me upset because the look on his face whenever he said that, it was really disheartening.
Yeah. Yeah. Well, just keep going about with the way you want to do things, okay?
Okay.
All right, let's see. We did that one. Fall prevention. So just a quick review of that. Most falls occur in patient and residents' rooms and in their bathrooms. Causes include poor lighting, cluttered floors, throw rugs, and out-of-place furniture. Wet and slippery floors, bathtubs, and showers, okay? Needing to use the bathroom, usually to urinate, is a major cause of falling. So every time you leave that patient, you want to make sure that you've asked them if they need to go to the restroom, because that is a major cause of them falling, is that you're either so busy out there and you're not answering the call light, or it's been so long that they try to get up and go themselves. Okay, so I'm sure that that's on the test somewhere. Most falls occur between 1600 and 2000. They are also more likely to occur during shift changes. Why? You remember this one?
Because they're not paying attention.
Right. We had that on a quiz or a test. Communication. Often falls occur when a patient is trying to get something that they need. So make sure that all of the stuff that they need, like remotes and call lights and water, et cetera, are all next to them. Prevent falls by asking, what things would you like near you? Can I move this closer? Can you reach your cane, your walker, and wheelchair? Do you need to use the bathroom, or is there anything else you need before I leave the room? Okay, so that all helps. All right, so we talked a little bit, we had class on transfer belts and gate belts. Hopefully you guys got a lot of practice with that, or some practice, I don't remember. Did you get some practice with gate belts?
Yeah.
Okay. A transfer belt, also known as a gait belt, is a device used to support a person who is unsteady or disabled. It helps prevent falls and injuries. When used to transfer, it's called a transfer belt. When used to help with walking, it's actually called a gait belt. The belt is always applied over clothing and around the waist. Remember that? The belt buckle is never positioned over the person's spine. Why do you think?
Breaks it.
What's that?
Breaks it.
Yeah, it affects the skin and stuff.
It rubs against the skin.
Exactly. So it can cause a wound, actually. Do not leave excess strap dangling. Why do you think that's a problem?
It could get caught on something.
They can get caught on something. They can trip on it. You could trip on it. All right, remove the belt after the procedure. Okay. Always check with the RN and care plan before using one. Always apply it over clothing, never over bare skin. Apply around the waist, under the breasts, not over the breast. Okay. Buckle never positioned on the spine. Hold on to the gait belt and walk slightly behind a stroke victim. Okay. Falling may be caused by weakness, lightheadedness, or dizziness. It also can be caused by fainting, slipping, or sliding on spills, wax floors, throw rugs, or improper shoes. Do not try to prevent the fall. If a person starts to fall, ease him or her to the floor. You remember how we did that? We kind of got behind them a little bit, bent our knee and eased them to the floor. That's kind of the procedure we would do. Do not let the person move or get up before the nurse checks for injuries, okay? An incident report is completed after a fall. All right, here's a little question for you. A PCT is walking a stroke victim using a gait belt. The correct procedure would be, and it says, hold the gait belt while walking slightly behind them, okay? All right, let's move on. Asepsis is being free of disease-producing microbes. Sepsis means infection. Medical abscessus is clean technique, right? And it's used to reduce the number of microbes by removing or destroying pathogens. Prevent pathogens from spreading from one person or place to another. What does that say over there?
Surgical asepsis.
Okay.
Technique.
Surgical asepsis is the sterile technique, okay? Keeps items free of all microbes. That's what I'm going to do. All right. You may, you move from a contaminated body site to a clean body site. Your hands are not visibly, I think it must say dirty, right?
Soiled, yeah.
Yeah, all right. You guys are sitting on my words. What should you do? All together, practice hand hygiene, right? Okay. So anything that's highlighted, make sure you pay attention to that, okay? Sterile means the absence of all microbes, pathogens and non-pathogens. Sterilization is the process of destroying all microbes. Contamination is the process of becoming unclean. In medical abscessus, an item or area is clean when it is free of pathogens. A sterile item or area is contaminated when pathogens or non-pathogens are present. Aseptic practice breaks down the chain of infection. Hand washing, girls, is the important common aseptic practice. All right, so standard precautions. They're part of CDC's isolation precautions. They reduce the spread of pathogens, reduce spreading known and unknown infections, are used for all people whenever care is given, okay? So standard precautions are always used. And they prevent the spread of infection from blood, all body fluids, secretions, and excretions, even when the blood is not visible, non-intact skin, so if there's a wound, and mucous membrane, okay? Standard precautions, I have to get ready for you guys for a second. Standard precautions are used universally with all patients. It reduces the number of HAIs. Use PCP when handling body fluids, non-intact skin, or mucous membranes. Practice hand hygiene before and after each patient, and safely expose abused equipment, needles, and sharps. All right, droplet precautions. I think that we had this on a test too. Droplet precautions are used with patients who have infections that spread via droplets, larger than 5 microns. Okay, so there's a list of things that are larger than 5 microns. Must wear a mask when within 3 feet of that person. Okay. So again, I want you to kind of review all these. Airborne precautions are required when droplets are smaller than 5 microns, like with tuberculosis. They can spread farther and last longer. Requires patients to be in a negative pressure room that restricts the airflow. Patients will also wear masks, and it requires good hand hygiene and wearing PPE. Contact precautions are required for those with infections that spread via direct contact or indirect, okay? Even with surfaces. Infections include diphtheria, herpes simplex, scabies, hepatitis A, etc. You're going to wear gloves, gowns when handling items in the patient's room. The bloodborne pathogen standard is OSHA, is regulated by OSHA and is intended to protect health team from exposure. Things like HIV, hepatitis B, found in blood are bloodborne pathogens, exit the body through blood and are spread to others by blood. Other potential infectious materials also spread HIV, HPV. All right. Very important. What is the correct order for putting on PCT? Okay. So remember, it's going to be gown, mask, goggles, and gloves. When removing a gown, you're going to turn the gown inside out as you remove it. Remember how to do that? Okay.
Yes.
All right. What is the purpose of wearing a face shield when providing patient care? It's to protect your eyes, mouth, and nose from being infected through splashing. Okay. All right. Principles of surgical asepsis. All items in contact with a person are kept sterile. A sterile field is needed. A sterile field is a work area free of pathogens and non-pathogens, okay? Sterile gloving. Before donning sterile gloves, the sterile field is set up. After sterile gloves are on, you can handle sterile items within the sterile field only. Do not touch anything outside the sterile field. All right, a sterile item can only touch another sterile item, right? Right. All right, you guys remember this question, I'm sure. While assisting a nurse with a catheter, you created a shield between the patient's legs. All of a sudden, that patient moves her legs and touches the sterile field. What action should occur? So you remember, you can't clean that area. You have to actually start all over again, okay? That means you put everything in the trash, get another kit, start that field all over again. Does that make sense?
Yes.
All right. Okay, so this is 22, 23, and 30 in one slide. So I've kind of broke it down, okay? That's kind of what the whole idea was. I know there's a lot of material we went through, so I've kind of given you just, you know, a little synopsis of what you really need to know. All right, so this first one. When completing female perineal care, clean the labia upward from front to back. Very important, right?
Yes.
Why do we do that?
Infection.
Exactly. If we go back to front, we're bringing feces close to an area that could have a UTI. Okay. During perineal care on a male, you should clean the rectal area from the scrotum to the anus. Okay. Again, you're always going from cleaner to dirty. How should you position an unconscious patient when you're giving oral hygiene? So you're going to turn that patient on one side. All right. This is always reminds me of Rebecca. Turning the joint downward is pronation. What was your little saying? You have a saying for this one?
Hold the supination.
Okay, you guys remember that? I will take that one to my grave, I think. Hold the soup is supination. Pronation, of course, is the opposite. Okay, so you might, Emily, I think that you were absent for that one, right?
I was absent for the range of motion.
Okay, so for you especially, but everybody, make sure you review all of the positionings. So this is just an example of pronation and supination, but make sure you're kind of looking over the different ways to, you know, the positions, because you weren't here for that, and we did practice that quite a bit. Okay, we have 10 more minutes, girls, on this slide, and then we'll reconnect. A trochanter roll helps prevent the hip from turning outward. Remember that, okay? Remember, we put it, so we don't want the hips to roll outward, so we roll up something and put it aside the thigh. Okay. When changing the gown on a person with an IV, always have the nurse check the flow rate afterwards. Okay. We kind of talked about this even recently. Active range of motion exercises are done by the patient. So somebody who is quadriplegic, are they going to be doing active range of motion on themselves? No, remember that. Passive range of motion exercises are done by you guys or the nurse or whoever. You're doing the entire exercise for that person. But a combination of that, where they help and you help, is called active assistive range of motion exercises. Okay? Here we go. 17, bend your knee. This is all about body mechanics. So you're going to bend your knees and squat to lift a heavy object. You're never going to bend over at the waist. Okay? Hold items close to your body and have a base of support. So you're not going to carry something really heavy with extended arms. Repositioning prevents pressure ulcers and contractions on your patients. That's why we at least do it every 2 hours. Patients are repositioned at least every 2 hours. So this safety check is on the inside of the cover of your book. Okay, make sure you know that, but I'll say it real quick. So this is a safety check before you leave a person's room. Make sure they have their eyeglasses, hearing aids, and any other thing they need. Their call light is plugged in and close. Bed rails are up or down according to the care plan. Bed is in the low position. Bed position is locked. The manual bed crank is in down position. Bed wheels are locked. Any assistive devices are closed. Overbed table with fresh water, tissue, phone, TV control. Any unneeded equipment is unplugged or turned off. Any harmful substances are stored properly, including mouthwash, lotion, and shampoo. If you remember, with my mom with Alzheimer's, I couldn't understand in the beginning why they kept putting her mouthwash and things away. That's because she got confused and probably was not using them correctly. Ensure the safety of food and other items brought in by the family. So if the person's on a low sodium diet and they brought them a pizza place pizza, might not need to be in the room, right? Floors are free of spills and clutter. All right, here are the positions of the bed. Make sure you know that, okay? High Fowlers, straight up and down. I could not sit like that. Okay, this is more of a high Fowlers, which is 60 degrees. Most often people are in either a Fowlers or we use semi-Fowlers a lot. These two positions, if I remember right, can increase the chance of having like a bed sore right here, right in the crease of it because it's still too high. So you want to kind of take pressure off of the tailbone by going semi-Fowlers. All right. Let's see if we can get through chapter 18. I think we're good. Now, if it cuts me off, don't laugh, and we'll start right where we stopped, okay? Because it doesn't really warn me very well. All right, protecting the skin. Protect the person's skin during moving and transferring procedures. Remember this, friction is the rubbing of one surface against another. So rubbing the tailbone against the mattress. Shearing is when the skin sticks to the surface while your muscle moves. So if they're sweaty and you start to move them and their skin is actually sticking to the sheet and you start moving them, you can get a skin tear, okay? Reduce friction and shearing when moving the person in the bed by rolling the person, using friction reducing devices. To protect the person's skin when moving in bed, roll the person. Draw sheets and slide sheets are used to reduce friction. Log rolling is turning the person as a unit in alignment with one motion. The spine is kept straight. The procedure is used to turn older persons with arthritic spines or knees, persons recovering from hip fractures, persons with spinal cord injuries, and persons recovering from spinal surgery, okay? And that is the log rolling. All right, let's keep moving on. Chapter 24. The healthy adult produces about 1,500 milliliters or 3 pints of urine a day. People usually void at bedtime, after they sleep, after they wake up, and before meals. Some people void every 2 to 3 hours. Actually, some people void like me every hour. So everybody's different. You need to know your patient. Some persons need help getting to the bathroom. Others use bedpans, urinals, or commodes. Factors affecting urine production include age, disease, the amount and kinds of fluids they ingest. So if they've had a cup of coffee, that's a diuretic, and it's going to produce a lot more urine. If they have dietary salt, they might produce less urine because they're retaining fluid. Body temperature and perspiration. Drugs may alter how much or how little, okay? Frequency of urination is affected by the amount of fluid intake, habits, and available toilet facilities, activity, work, and illness. When applying an incontinence product, apply a new product from front to back. Remember that. Front to back usually is a good way to remember that. All right, let's see if we can get through this one. Observe and report the following to the nurse. If allowed to a chart, also record the following. So kind of look through what the color should be in urine. You should know about the amounts, which we just went through. Tell me about consistency, so review that. Any presence of blood or mucus, odor, shape, frequency of bowel movements, complaints of pain or discomfort, liquid stool or diarrhea, hard pebble-like stool with constipation, no stool for more than 3 days, unless MPO for several days. These are all things that you would be reporting, okay, or charting. An unusual quantity of stool or frequency of bowel movement. So if they're going to the bathroom every hour, that's not normal. Visible blood in the stool, tarry, dark looking stool is actually is black in color. Visible pus or fat in the stool. Unusual objects or substances in the stool, like toys in children, marbles, something like that. All right, stools are normally, this is important, stools are normally brown, soft, and formed. Okay, your state and agency allows you to insert rectal suppositories. You insert a suppository along the rectal wall. Remember that. Remember, it's not straight up, it's along the rectal wall, okay? Study your enemas and your suppositories and ostomy care. All right, here's just a little note. In adults, the enema tube is inserted 2 to 4 inches. The pouch has an adhesive backing applied to the skin. Some are pre-cut, while others require cutting an opening of 1/16 inch, larger than the stoma. Remember, we reviewed that. That was on one of our tests. Wash the skin around the stoma with warm water when changing the colostomy appliance. You would not use like an antiseptic or alcohol because it would burn, correct? All right. You think I can do this? Here we go. Chapter 27. Let's see. Chapter 27. Protein is the most important nutrient for healing, okay? It helps with tissue growth and repair. Which of the following is a sign of swallowing problems? Coughing while eating, okay? So if somebody coughs all the time when they're eating, they could be having swallowing problems. Normal fluid requirements. An adult needs 1,500 milliliters of water daily to survive. Okay, that doesn't mean that that's what they really need. That's just to survive. About 2,000 to 2,500 are needed for normal balance. That's a gallon. So I gave you an example of how much a gallon is. So it's under a gallon, but it's pretty close to a gallon of water a day. The water requirement increases with hot weather, exercise, fever and illness, excess fluid loss. I&O, the following fluids are measured and recorded. All fluids taken by mouth, foods that melt at room temperature, IV fluids, tube feedings. Output includes urine, vomitus, diarrhea, and wound drainage. Remember all those, girls, okay? Intake and output are measured in milliliters. Now, this bottom part, I do want you to really review because there are a few math problems. 1 ounce equals 30 milliliters. 1 pint is 500 milliliters. 1 quart is 1,000. And there's your question. A person drank 8 ounces of milk. How many milliliters would you record on an I&O sheet? That would be 240, because you're going to take the 30 milliliters and you're going to times it by the 8.